Welcome to the webinar for Skilled Nursing Facility Consolidated Billing for ambulance suppliers. This webinar is designed for ambulance suppliers to learn about when they should bill a skilled nursing facility, and also for skilled nursing facilities to learn about when they need to pay for an ambulance transport. So it's Skilled Nursing Facility Consolidated Billing for ambulance suppliers. I'm Tom Ryan with Provider Outreach and Education, and I'll be your presenter today. Today, I'm also joined by Mary Sue from my team. She's going to help with the questions, place some information in the chat. She's also one of our clinicians, so if there's a clinical answer that's needed, you will definitely hear her jump in. I know enough about that clinical aspect to be dangerous with ambulance billing, so she's going to jump in if need be on those. A little bit of housekeeping. We do recommend that everyone downloads the presentation. It is available in our training center, and it is available on the live events page. You can download it up through tomorrow maybe, or later today. I'm not sure exactly when it's going to be taken down, but at the latest, it'll be tomorrow morning. Once it is taken down, we will repost it in the Encore presentations page. Once posted in the Encore presentations page, it will be available for 60 to 90 days. It will also be a link on that page or a viewer on that page as well. So there's a link and a viewer. The link takes you to the Encore presentation available in YouTube. The viewer simply plays the presentation. Now, again, that's available for 60 to 90 days. However, it does stay in YouTube for much longer. It just depends on information changes, all of that. For today, I will take questions. I really need you guys to ask the questions. Let's put them in chat though. By doing that, you can put them in as they come up when you think of them. It's the best way for us to make sure we get you the needed information, okay? After the event, I'm going to ask you to take a survey. The goal of the survey is to give me the good, the bad, and the ugly. What does that mean to you? What did I do well? What did WPS do well? Because there'll be two different sets of questions. Also, what could have been better? What could we have done better? Could the presentation have been better? Could the websites that I used have been better? Any of that type of information. The last thing I always call the ugly, but that's simply my presentation. Was my presentation up to your standards? What would have made the presentation better? So please be aware that that survey is very important, and we'll talk more about it at the end, but I want you to know that you're going to get it. Couple of disclaimer pieces. The information given during this webinar is for informational purposes only. One of the things that happens with Medicare, and anyone who's been in Medicare for a little while knows, Medicare changes. And because of those changes, you do need to follow the most current rules. I will provide you with the information that is accurate as of today, but you're responsible for making sure you follow the most current rules. We did have some questions sent in, and I will answer them to the best of my ability based on the information that was sent in. When it comes to ambulance, small details can actually change the answer, and we'll talk more about that. So remember, the Medicare rules, regulations, and guidance will always have final coverage. This presentation is simply for informational purposes. With that said, the Medicare rules, regulations, and guidances are available on the CMS webpage. If you choose to download this presentation, the CMS webpage is a link for you, and you can use that to go directly to the webpage without having to navigate. I will show you how to navigate to the webpage and move around a little bit as we get more into it. So what is our objective today? Our objective is to help you determine when you should bill the skilled nursing facility as an ambulance company versus when you should bill Medicare. Also, we will add in some additional information about when you should bill the patient. Okay, so when should you bill Medicare? When should you bill a skilled nursing facility? Or when should you bill the patient for an ambulance transport? One of the things that we did is put together the agenda based on the questions that were asked and the information that was wanted. So there were some of you that asked about general information. I had one of you tell me you were new to this concept of consolidated billing. So I wanted to make sure I gave you the basic pieces of information. So again, if you have any questions during this basic part, let's get that answered right away. The second area that was asked about was the CMS files, and those are specific files that will help you determine by procedure code whether or not your ambulance run is included in the skilled nursing facility payment, or does Medicare offer a separate payment for it. Last, we do want to focus on the questions that you asked that weren't part of already given or anything like that. And those will be the pre-submitted questions followed by the chat questions. So we'll go through everything that you pre-submitted. We want to encourage you to do that in the future. Okay? Here's how the questions will work. I'll read through the ones that were pre-submitted and give you the answer. Then Mary Sue will read me the questions in the chat and I will answer them verbally. So versus going to you and having you open each one, close the lines, kind of going back and forth in order to save time, we're going to do it that way. So that's why the chat's so important. If you want to make sure that you have access to the chat, right now is the time to do it. Just say, hey, I'm here. Hi, I can hear you, whatever you want to do, but it's just to make sure you have access to the chat. That's all we're doing with that. All right, let's get started with this general information. Now, again, we built a section just for general information, and we built it because people were not familiar with it. We had some people tell us they were new, and I don't want to leave anyone behind. So for some of you, this will be a review. So the first thing you have to know is when we talk about skilled nursing facility consolidated billing, we are talking about a bundled service. The bundle is part of the skilled nursing facility payment. In other words, Medicare makes a single payment to the skilled nursing facility when the patient is in a medically necessary covered Part A stay. We'll explain a lot more about all those terminologies in just a few moments. With the exception of services that are outside the SNF's scope. An ambulance is very unique in that it is sometimes outside the SNF scope and other times it's considered part of another service that is within the SNF scope. That's what we're here to determine. When is it considered part of another service, therefore billed to the SNF, versus outside the scope because the service is outside the scope as well. And that's what gets confusing for ambulance providers. How do we determine that? And we'll talk about that in just a little while, but I want to get through these basic definitions first. Medicare also talks about skilled care, and this is where Mary Sue may have a little bit more input, but we'll see if after my definition what she has on this one. So what is skilled care? The basic definition is nursing and therapy care that can only safely and effectively be performed by a professional or technical personnel. It is a medical staff with their medical training that is required. Skilled care is under the supervision of a medical doctor or other qualified person by Medicare, which would be a non-physician practitioner in some cases. Okay, so such as a PT if they're supervising the PTA or the physical therapy assistant. So a physical therapist can supervise an assistant. That's still considered part of skilled care. In order to meet this definition, the care must be to treat, manage, and observe the patient's condition and to evaluate the patient's care. So when we look at skilled care, that's what we're looking for in a nursing home setting, the skilled portion, which makes it skilled nursing facility versus just nursing home care. Before I move on, I would like to ask Mary Sue if she has anything else that she'd like to put in at this point about skilled care.
I don't, Tom. Thank you. I think you got it covered.
Thanks. Again, that clinical aspect sometimes throws me off, so I wanted to make sure I hit everything for you guys. All right. Now, Medicare does divide skilled nursing facility stays into two types of stays, and this is key for determining who to bill. So in a skilled nursing facility, during the first 100 days of a benefit period, it is called a Part A stay because Medicare will pay for the skilled care, the room, and board. That's the Part A covered inpatient care. Once 100 days has been met in a benefits period, then we move on and we go to Part B stays. A Part B stay means that it is not being covered under Part A. In other words, we're not paying for the room, the board, we're not paying any of that. We could pay for some of the skilled care, but it becomes under the Part B benefit, and the patient must have Medicare Part B. So Medicare Part A stay during the inpatient care, yes, that is the first portion. Okay. 100 days, they must have Medicare Part A. Then 100 days lapses or goes by, Medicare's paid for it, and we're done. Now, one of the things that you've noticed is it does not meet the Medicare skilled care criteria. That will mean that it is no longer considered a medically necessary Part A stay. They may remain in the facility, but then they move into a Part B stay. You can write next to this, you can do whatever you want, but if the patient is in a Part B stay, ambulance runs are automatically billed to Medicare. Automatically billed to Medicare. Okay, so that's the difference. If they're in a Part A stay, now you have to determine the services at the end location, and we will talk more about that in a little while. I was specifically asked about a a stay that does not meet the 3-day qualifying stay. This is a technical requirement for Medicare, and if it doesn't have a 3-day qualifying stay, the skilled nursing facility will not be able to bill Part A. The 3-day qualifying stay must occur in a hospital or critical access hospital no more than 30 days before the admission into the skilled nursing facility. Hopefully that answers your 3-day qualifying stay question. It was probably something someone has heard before, so I wanted to make sure. If not, please put that back into the chat. One thing I do want to mention at this point is what lapses or what ends a benefit period. And that is Medicare Part A is no longer covering the stay, but not just in a skilled nursing facility. It's any inpatient stay. So are the inpatient in a hospital, etc. And it's not about 1 day. It's actually a 60-day lapse in inpatient care. That is 60 calendar days. So first, yes, you could have more than one benefit period in a year, but could you also have one benefit period in a lifetime? And the answer to that is also yes. And that would be someone like a tube feeder who needs that continual skilled care for the rest of their life. So when we look at it from the ambulance perspective, you must determine whether it's a Part A or a Part B stay. And again, we'll talk more about that in just a little while. Medicare also uses the term excluded services, and we hear this term used a lot. And then it gets confusing with skilled nursing facility consolidated billing or SNF CB excluded services. So let me define for you the two types of excluded services. First, there is a Medicare excluded service, which means Medicare will never cover it. This is an ambulance transport that is not medically necessary. It's not medically necessary. There's nothing you can do with that. This means there's no legal obligation to pay for a service. There's, a variety of factors that happen with not medically necessary. They're excluded under the law. In this case, if it is a Medicare excluded service, skilled nursing facility consolidated billing does not apply. Well, then who's responsible for that? It is not the SNF's responsibility unless you have a contract with them stating something like, we're going to act as your wheelchair van and you're going to pay us for that wheelchair van service. That's a different situation. Otherwise, it is considered to be patient responsibility because it is not part of the Medicare program. Never part of the Medicare program. So hopefully that makes sense for Medicare excluded services. You will also hear the term SNF Consolidated Billing excluded services. And remember I talked about outside the scope of the SNF. So while it is a medically necessary service, the SNF simply can't provide that service. Example, an emergency room service. We don't expect a SNF to provide emergency room services. Okay, so when that happens, the ambulance run to the emergency room or from the emergency room is excluded based on SNF excluded services if it's medically necessary. If it's not medically necessary, then it's excluded based on the fact that it's a never covered service under Medicare, and you want to make sure you're well aware of that. So hopefully I am getting that correctly back in. I was specifically asked by a small community ambulance service. This is how they labeled themselves in the question, small community ambulance service. And someone who lives within their community has no legal obligation to pay that transport service. However, if you live outside the community, you do. And it's done through a tax base if you live inside the community. That would be considered an excluded service for those members living within the community. They're paying through the taxes and they are not charged for that service. But if they live outside the community, then it's not an excluded services and we fall back into the medical necessity portion for the ambulance run. Very confusing situation with that one. So if you need more on that, please feel free to throw some stuff into chat. I know that that one is a bit of a harder one to go back and forth with. But please remember that if it is a Medicare excluded service, never payable by Medicare, it is not the SNF's responsibility to pay it unless you have a legal contract where you are acting such as a wheelchair van or something like that. It is billable to the patient. It's not part of their benefits. Okay. We did talk about this next slide, and it's that 3-day qualifying stay. And so let's really focus on this because this tended to cause a little bit of confusion in a couple of my classes that I've also taught. Okay, so inpatient hospital stay. It is defined as they are admitted inpatient in a medically necessary hospital stay. It does not define a critical access hospital or an acute care hospital. It says hospital. So that means it can be any type of hospital. Inpatient rehab facility is a type of hospital. Inpatient psychiatric facility is a type of hospital. So I don't want you to think, oh, it's only those certain types like critical access, small community hospital. Yes, that is a type of hospital, but it's not the only one. Acute care hospital, level 1, trauma center. No, that's not what we're talking about. It's just anything that defines as a hospital. Once they discharge from that hospital and they have a 3-day qualifying stay, then they have 30 days to admit to the SNF. And we'll talk about the caveat that goes with that in just a moment. One thing that it has been noted is that it does count the day of admission. It does count the day of admission. It does not count the day of discharge or any observation stay. Observation is outpatient care. The day of discharge is the day they leave the facility and is not part of it. So the way you make a 3-day qualifying stay is the admission day, then the second day is a full day in the hospital. The third day is a full day in the hospital, and the discharge day is the day they'll leave and they'll go to the skilled nursing facility in most cases. So when we're looking at that, it's a lot of people refer to it as 3 midnight census. It's another way of commonly saying it. So yes, those different types of facilities, again, hospitals would count. And I want to make it very clear because that was a question that did come up. This person was inpatient. They left regular observation care after an ER. Neither one of those are considered, and I want to make it clear, neither one of those are considered part of the 3-day. They went to a psychiatric facility. They were admitted to the psychiatric facility. They left the psychiatric facility 5 days later. So that counts as 4 days. Remember, admission, full day 1, full day 2, full day 3, and then discharge, which is 5th day. That does count. Inpatient psychiatric facility will count. So hopefully I have that cleared up, and the questions that I got within the pre-submitted questions, I'm answering those well enough. All right, let's take a look at the next section, and I'm going to tell you that the slides that are built into this one are to help you kind of move through a little bit. We'll get through a few of them, and then we're actually going to go out and take a look at the website. So we'll kind of go through a little bit back and forth between the slides and the website. Okay. So the basic thing to remember when we look at the CMS files is that it is on the CMS website, and that website is cms.gov. Okay. Now on slide 13, I did give you a location, but let me show you how to find it. If you said I just typed SNF Consolidated Billing, super easy way to find it. I'm going to walk you through the long way just in case you ever need it. So again, we're talking about Medicare. So we're going to go to the term Medicare. Okay, it's right under the CMS logo. Then we're going to move down and we're going to go to coding and billing. Once you select coding and billing, there'll be a change on the right side and you're going to go all the way to the right-hand column and you're going to go to the second item and it's SNF Consolidated Billing. Okay, here we go. Now we're in this and we're like, oh my gosh, look at how easy this is. And then we're like, wait a minute, how come there's all these files and some more files? What's going on? So we're going to talk about these files a little bit, okay? So first, remember I said you have to ask the SNF what type of stay they're in? Because if they're in a Part B stay, then do the ambulance runs even get considered as part of bundling? And the answer is no. So this is on slide 14. You're going to talk about that. So you don't even want to look at these files. Don't need to worry about it. If they're in a Part A stay, now we do need to look at these files and we need to understand these files. The first file that people typically look at is this Part B MAC update. Right here, it's 2025 Part B MAC update. Now it is by year, so we're just going to use the 2025 because it's the most current one. When we select that, it will give you the files that have been added and the procedure codes that have been added. But I want you to note it is by procedure code. Okay, it is by procedure code. We're going to scroll down because I don't see any of the ambulance codes added in any of these files. And it would be file 3, and I'll tell you that in just a moment. Kind of goes through. How do I know that? Well, it's labeled Part A stay file 3. So this tells me this only applies to file 3. Physician services, other things are in here. Let's go ahead and open this up. Okay, the first thing that's going to happen is it's going to ask me to unzip the file, which is what I did here. It's just opening the file. Now I have this pre-open because it does take some time. And this is what the actual Excel file looks like. Oh, I'm sorry, you guys. I did mess up. I'm on slide 16, not slide 15. I'll go back to slide 15. I apologize for getting these out of order. So what it says, and most people read this, these codes are not subject to SNF Consolidated Billing. They should be submitted to the Part B administrative contractor for payment. And then they read the ambulance codes and they're like, shh, I don't have to worry about it. What I want to let you know is that doesn't consider the bundling portion. Is it part of another procedure? So for instance, your ambulance transport may be bundled into an MRI if it's done at a freestanding MRI facility or diagnostic area. So a mobile MRI, all of those types of things, it would be bundled into that. It's not that the ambulance run is separately billable, which is what you would think with this, but that's not true. What you have to do is look and say, okay, is the MRI separately billable? Because in order to get the MRI, the ambulance run is considered part of the MRI and must be billed in the line on the SNF claim as part of the MRI cost. So it's not separately billable with the SNF revenue, the SNF claim, inpatient SNF claim, with revenue code 540. Not going to happen. You're not going to get that transport code paid for Medicare. So that's one thing. And I don't want people to be confused by this statement here. What this is saying is if it is not bundled, such as done in an emergency room, then the transport to and from that emergency room, if both are medically necessary, then yes, you can bill these to Medicare Part B. Even though they were in a skilled nursing facility, Part A, medically necessary stay, consolidated billing does not apply based on the fact that the service was done in the emergency room. Now, we're going to get a little bit more into that caveat in just a few moments because there is another caveat. So again, lots of things going on, and this is why ambulance is a bit confusing. So I want you to remember that when you're looking at this file, while it does state that these are separately billable codes, that is correct. They are separately billable codes, okay? However, this does not mean that they are not part of a bundled service, and so you must determine the bundled service first. Which brings us, and I'm just going to go ahead and minimize this for a minute, which brings us to the Part A file. Okay, and this is slide 15. Now the Part A file works differently in that it has major categories. Got to scroll back up so I can bring you guys to see the Part A file right here. Okay, so you can see it's labeled Part A Mac. When we open it up, it explains that here's additions to major categories, when they were added, all of that. We're just going to scroll down. Sorry about the fast scroll. Couple of things I want you to be aware of. One, read the general explanation, and I'm going to start here. Okay. When I open the general explanation, there we go. Mary Sue, can you see the general explanation? It blinked at me and did some weird stuff and then popped up.
I can, Tom.
Okay. Whew. A little panic there for a minute. Okay, so the general explanation is updated annually. It's just another way of reading the Part A files. And it's done by major categories. Okay, so a lot of people are aware of the major categories. And then they say, oh, I see a major category. It's automatically excluded because it's an MRI. It's done in an emergency setting. Except that would be major category 1. And then they skip this paragraph. Then they skip all these things. Why is this paragraph so important? Because and this paragraph comes into play if you read it, excluded from SNF PPS, okay, for beneficiaries in a Part A stay. We're good with that part. That's what we're talking about. Services directly related to these services billed for the same place of service with the same line item date of service are excluded. Okay, cool. So then we read through, but you have to read through each section of it. These services must be provided on an outpatient basis in a hospital, including a critical access hospital only. So they are not excluded if they're done in a freestanding facility. And this is where I gave you the MRI, either in the mobile unit or in a freestanding diagnostic. They're included. Well, then it says down here, if we continue down, oh, here's ambulance transports. Well, when does an ambulance transport become a bundled portion? And it explains ambulance transports associated with major category 1A through E, okay, right, are excluded. In addition, transports in major category 2A, I'm sorry, I did skip G, but are also excluded. So they have to be associated. Okay, so that means A through E, but not F and G. Now, the reason it's not F and the reason these are not excluded is because this is an inclusion list to start with. So if it's associated with an included surgery that the SNF could safely do, it's not an exclusion. So that's why it's A through E and then G. Now, here's another caveat. Not only does the emergency room have to be at a hospital or critical access hospital, right? It also needs to be billed by the critical access hospital or hospital with the proper emergency room revenue code. Oh my goodness, that's a lot, right? If all of those criteria are met, then the ambulance transport is separately billable to Medicare. Okay. Same thing would happen with any of these other categories, including 2. Again, we're going to just jump down to 2, major category 2A, which says, okay, these are excluded services and it's for these types of related services. And then it explains a lot more. Well, then one of the questions we get is, wait a minute, how do I know what this means? Like, this is great. It's a great explanation, but how do I know what it is? And the answer is you have to open another Excel file that actually incorporates the major categories. Okay. So here I just, again, would go back. I will select this zip file. It's going to pop up something that looks like this, and I'm going to open up the top one. Okay. When I open up the top file, I get this. And you're like, oh my, so I have to know what this procedure code is in order to use the file. As an ambulance provider, where do you get these procedure codes? You have to ask. There's no easy way to say, yep, I just got it. No, you have to ask. Now, it's not against HIPAA for them to give you this information because it is needed for this. You can ask the skilled nursing facility. You could also ask the destination that you took them to. Hey, what procedure is being done here? But you do need this code. And then you need to determine, was it in a hospital or critical access hospital? For instance, for this one, which is CT scan. So if it's a CT scan and it's in a freestanding facility or a mobile CT, then it's not excluded. But if it's in a hospital or critical access hospital, it is. So you have to ask, hey, what code are you billing? What code did you get billed? So there's a lot going on. Again, I want to remind everybody, it's about the communication between the two that go back and forth. So as we go through, and you can see there's just a lot of procedure codes. I was asked if you have to like scroll through the list. I don't ever scroll this list. I highlight that particular section and I say, I want to be able to bill, let's just do, and I find out, oh yeah, it does it. So I just brought up my find feature, which is Control F, edit, find, whatever you want to do, you can do that. Another way is way up on the top. If you want to, on this first row, you can go up to the top on the top and go data. So on the very top in the navigation bars, the data ribbon's gonna open and you can throw a filter and then you can use that to look through any of the procedure codes that you want. Okay, any of the procedure codes that you want. I want to scroll down for just a second and I'm gonna look for major category 1. Oh, no, I'm not gonna scroll down. I'm gonna use this. And I'm gonna say, okay, I want major category 1H. And I'm just gonna unselect all and say, okay, 1H. Now these are the procedure codes that are bundled sometimes and not others, but how do you determine if these major or if these procedure codes are bundled? You have to know the destination, the to destination. I took them from the nursing home to. Now, is that service bundled or not? So hopefully that all makes sense to everyone. We'll get into that when a little bit more questions come up and things like that. Let's jump back to the slides for just a couple of seconds here. We did go through this slide. We did do that slide, and that slide. So we're on some notable items slides, and these are just circumstances that you need to be aware of. One, CMS does state that if it is a SNF to SNF transport, skilled nursing facility to skilled nursing facility, in other words, the ambulance transport is an N-to-N transport, it is the first or the skilled nursing facility that you are leaving who is responsible for payment. What I did is actually asked Mary Sue if she would put the Medicare claims processing manual section and information for you into the chat. And that section does go on to tell you a little bit about it so that you're aware of what's going on with that. Now, it does talk also about the physician's office. If the patient is in a medically necessary stay at a skilled nursing facility, when you transport to a physician's office, which would be a non-covered destination if they were in a Part B stay, but if they're in a medically necessary Part A stay, then you must bill the SNF. Now, I know that typically a physician's office is not a covered destination by law unless it's an emergency stop. We understand that. But what it does go on to say, and it gives you in the section that Mary Sue gave you, that in the Code of Federal Regulations, it explains this, and it'll actually give you the Code of Federal Regulations. You can go out and take a look at it. But essentially what it says is the reason that this happens is because it's not a Medicare billable service directly to us. It's billed to the skilled nursing facility. So keep in mind, would it have been cheaper to have had a physician come to the skilled nursing facility and perform the service? Or is it cheaper for the patient to leave the skilled nursing facility and go to that office? And the answer is it's usually cheaper for them to come. Also, there's a safety factor, which I don't know a whole lot about other than that It's considered safer to not transport them when they need the skilled portion of the care unless it's medically necessary, such as to an ER. So if you're going to a physician's office, why aren't you doing the safer portion, which would be bringing the physician to them? I don't have a whole lot more information other than what I shared with you, but take a look at that section. Okay. Now, to admission, this is billed to Medicare. If you're going to the skilled nursing facility, it should never be the skilled nursing facility. Now, this is upon initial admission. Remember, I said SNF to SNF, end to end. That's different. If you're going hospital to SNF, which would be H to N. If you're going residents to SNF, R to N, those are the ones that are separately billable because they're not admitted. I was asked, and this is a great question, y'all. Well, why are they being denied then? And the answer is the Medicare system has a limitation. It doesn't track the time. It's not very smart, right? There's no way to track the time. There's something that says, well, they were admitted to the SNF at 3 o'clock and I took them from the hospital to the SNF. Therefore, this one's not included. So sometimes the system denies them incorrectly and you do have to do an appeal to get them paid. I don't know what else to say other than that. It's just our standard workaround. Okay. Let's do some question and answers. And what I'd like to do when we do this section is we're going to focus on the pre-submitted questions. Again, I want to make sure that everyone is done. Then what we're going to do is we're going to move on to anything in chat. So again, we do have a good portion of time. Please at this time enter any question you have into chat so that when we get through the pre-submitted questions, I can answer them for you and hopefully help you. All right. So the best way to determine if an ambulance transport is to be billed to the SNF or Part B. First, begin by asking a few questions. And some of these are asked to the SNF and some of these could be asked to the entity that you delivered the patient to. First, start with the SNF and say, is Medicare covering this stay? What you're establishing is it a Part B or a Part A stay? So was there a 3-day qualifying stay? If not, automatically billed to Medicare Part B. Also, is it medically necessary anymore? Was it medically necessary and now it's not? Then you're going to bill Part B. If it is medically necessary and there was a 3-day qualifying stay, okay. Now what is the patient in an excluded stay, which we already covered? Is the transport to an emergency room? If the answer is yes, then look a little bit further and you may actually have to go back to the destination facility and be like, hey, this is bundling and it shouldn't be. What's going on with it? And it is in how they bill. Remember, I told you it has to have a certain type of bill from the emergency room. If that type of bill is not received, it can affect your ambulance claims. And what was the service at the destination? By procedure code. That is key, by procedure code. Why do you need that? You got to go back and say, okay, it is a Part A stay. I have the procedure code. This procedure code is only covered as part of a hospital or critical access hospital by Medicare. So we did it at a doctor's office. Oh, guess what? The transport to the doctor's office is part of the SNF bill, and so is this procedure. Hopefully that kind of makes sense when you're asking those questions. Someone asked if there's a quick, easy way to get the answers and how to do this. If you have one, I'd love to hear it. Unfortunately, I don't. When it comes to this, it is a lot of communication back and forth. If you have certain skilled nursing facilities you're used to working with, maybe you have a monthly report or a process in place that you ask them these questions. There really is not the easiest way to get this information though. In terms of, hey, it's just in a system somewhere, you go look it up. It just doesn't work that way. The reason that we bring that in is someone asked, can Medicare have the common working file updated with the hospital and SNF bills available? Let me term it this way. The common working file is the communication hub for Medicare. The eligibility systems, the coordination of benefit systems, the claims processing systems, all communicate to the common working file. No, that's not all of the systems that communicate to this common hub, right? There's a lot more. So, okay. However, there the common working file doesn't actually update anything. It's all dependent on a system telling it something. That's part of that communication. So when it leaves the claims processing system, whether it's the multi-carrier system, which is for 1500 bills and 837P electronic transactions, or whether it's the physical intermediary standards system, FIS, which is for UB04 bills, or the 837I institutional transactions, whichever way, it has to go in and be updated. The catch with that is, did you guys get that it has to go through the system, complete processing before it goes there? So no, it's not quite as easy as you think. It's not quite as fast as we wish it would be. I understand that. However, once it's in there, you can look on the eligibility files, which are accessible to everyone in the Secure Net Access portal, the secure section of our website, and it does tell you the number of days used in an episode for a skilled nursing facility in the eligibility section under the Part A information. The catch with it is, of course, it has to be through and processed. This doesn't work exactly the same for someone billing on a 1500 or 837P as it does for the skilled nursing facility billing on the UB04 or 837I. They bill the initial claim and then 30-day increments, and then they bill a discharge. On the other hand, the people that bill in the 1500s and the 837P, you just kind of start billing your claims. That's why you get takebacks, and that's why the common working file may not be updated. They have to wait for the time frame to pass before they can even bill it. Who is they? The skilled nursing facility. They have to wait until after that time frame passes. And if one of their claims gets stuck for development or for any reason whatsoever, they have to get that claim through the system and processed before they can bill the next month. They have to bill in chronological order. So that's why sometimes it takes a bit of time to get onto the common working file. This question was specifically asked by someone who said they billed on a 1500 claim form or 837P electronic transaction. Okay. Now with that, I do give you guys a couple of manual references, and I do want to make sure you're aware of those manual references. These manual references are very good information and definitely useful for you. Okay, it's just one is all about how we process an ambulance claim, lots of good information. The other one is about the inpatient Part B and SNF Consolidated Billing. If you look at the specific section, you'll get your information. Okay, with these references up, I'm going to take a moment. What I'm going to do is just answer some additional questions, and then we'll get those chat questions. So first, one of the basic questions we got is, why is a SNF required to pay us for a transport? And the answer to that is, part of the Balanced Budget Act created consolidated billing. So it's part of a federal law. The SNF in their participation agreement agrees to follow all federal laws. So that's part of their participation agreement. When they do that, they then agree to follow the consolidated billing requirements. So if you're looking for more information on this, I really do recommend taking a look at the bottom one on here, the bottom link on this slide in the manual section, and it's chapter 6. And then please write down section 10.1. It's really just an overview. It's not specific to ambulance, but it is where the information comes from. So it's just a good reference to start from, especially if the SNF isn't paying you appropriately. The next question that we got is, what action does Medicare take if a SNF doesn't pay? I will tell you, if the SNF isn't paying you, that's not a Medicare action. It's a legal action between you and the skilled nursing facility, being the ambulance provider. So you do have to consult a legal counsel about an unpaid debt that is owed to you. Again, Medicare will pay the skilled nursing facility. That's what we have to look at. Okay? We are not involved if the consolidated billing portion of it. If you would like to take it to CMS regional office and central office, they may be able to help you, but we at the Medicare Administrative Contractor or MAC cannot. The next question is, billing the facility when they call 911 for a transport and you cannot bill the patient. This one throws me off a little bit, and I'll explain why. So first, Though they called 911, what establishes medical necessity is the emergency medical technician or EMT, whether it's basic, intermediate, or paramedic, doing an assessment. So if you arrive at the facility, even though the dispatch came through 911, this does not establish medical necessity. Once an assessment is complete, now it is medically necessary or it is not medically necessary. If it is not medically necessary, then it is the patient's responsibility as it does not meet the Social Security Act definition of a payable transport. This is in the Social Security Act, Section 1861S7. Okay. If it does meet it, then you would bill either the SNF or Medicare, depending on if the transport is to the to a excluded destination beyond the scope of a SNP, which is what we just went through all of those different pages for. So um, the other caveat to this, and you need to be aware of this, do you have a financial contract or some other type of contract that says you bill them for a certain type of service? So for instance, one of the counties that they have only has 911 as a dispatch. Okay. But once the ambulance arrives, because there's no wheelchair van available, it's not medically necessary, and they're going to act as the wheelchair van at 3 a.m. or whatever that time is that they don't have an available wheelchair van. That's not the SNF's response, or that, I'm sorry, that's not the patient responsibility, because there's a legal contract between the SNF and the ambulance company. I understood it was a 911 dispatch, but once they got there, it's not medically necessary. They could have gone safely in a wheelchair van. There's just not one available. Therefore, the contract from the skilled nursing facility to the ambulance company applies. So this one is a little bit tougher to answer, and there's a lot more caveats and other things that go with it. So I wanted everyone to kind of hear some of it. And if you have more questions, let's put those back in chat. At this point, I'm going to ask Mary Sue if we have any questions in chat that need to be answered.
Hi, Tom. So the first question is, does Medicare require a physician's order for an ambulance?
Good question. And the answer is it really depends on the type of ambulance transport. It is required, it is required for a routine scheduled transport, dialysis, for instance. And yes, that is a separately payable. That was one that was on list of major category 2 is a separately payable transport. So yes, you still have to follow the Medicare criteria. Could it be required under other circumstances, such as scheduled but not on a repetitive basis, so 24 hours or more in advance, but not on a repetitive basis, or unscheduled? Yes, the answer is yes, it can be, but it could also be something where someone who's familiar with it writes the information down too, and it's not signed by the actual physician. So it does follow the basic Medicare criteria, the same, what's called a physician certification, PCS. I'm sorry, I forgot the word statement. Physician certification statement, or PCS. It does follow those basic criteria, just like any other transport. So hopefully that answers your question. If not, again, put some more information back in chat. I'll give you more of a helping hand there. Is there any other questions?
Thank you, Tom. Yes, another question. It says we have dialysis on site. If someone is under a Medicare A stay and they want to go off site for their dialysis, is the SNF still responsible for payment?
So go back to that major category list, and I need to bring it up because I'm not, I can't remember on that one. I'm sorry. So we'll go to major category. We're going to go to part A, and we're going to go to the explanation list. Okay. So, and what I'm looking for is to see if it uses the term if the SNF doesn't provide or something like that, because each major category has its own specific guidelines. So we want to see right now, here's dialysis. These services must be provided to a specific beneficiary, again, end-stage renal disease is what we're talking about, by specific licensed Medicare providers and are excluded from the SNF BPS and consolidated billing. Okay. SNFs will not be paid for major category 2A services When the SNF is the place of service as to receive Medicare payment, these services must be provided in a renal dialysis facility. Hospice must be, oh no, we don't care about, that wasn't the question. So then we go on and we look down. So I want to make sure that we're meeting all of these different criteria. So SNFs will not be paid for major category 2A services, dialysis, etc. when the SNF is the place of service. As to receive Medicare payment, these services must be provided in a renal dialysis facility, which means that the major, the ambulance run to that is also not payable. So hopefully that makes sense. If the SNF is billing it and you're using the SNF facility according to this, you shouldn't be getting paid for that. And no, you shouldn't be paying the ambulance run if it's an external. It's external according to what this major category reads. Anything else?
Thank you, Tom. And that's the end of our chat questions at this time.
Okay, let me jump back over here to the slide deck then. So a couple more CMS resources. We went to the consolidated billing. We've seen that. I did want to give you the best practices guideline. This is about like contracts and things you can put in place to kind of help work with a skilled nursing facility, or the skilled nursing facility can get paperwork ready so that when the transport occurs, there's some different stuff in place. These best practices guidelines could be sent with you as the ambulance provider to the facility, to the destination, to help them understand whether they should bill a SNF as well, which does again directly affect you. The Skilled Nursing Facility Perspective Payment System, PPS. This page is about how a skilled nursing facility is paid. So if you remember, I described that they're paid in 30-day increments, they must process in chronological order, etc. That's where a lot of that information comes from. CMS does have a historic Q&A out there, and it is question and answers. It is about consolidated billing. I gave it to you. It may or may not help you. It's up to you to determine whether or not that will help you. There is a skilled nursing facility billing reference, and some of that will explain how Medicare looks at items such as the ambulance transports and whether it's a separately billable transport or whether it's included, remember, in a destination service. So for instance, is it included in an MRI? Is it included in something like that? And so you want to make sure you're aware of that. And then there's a billing reference, and then of course an on-demand course for this. We do offer it live just because it does get a little complicated, and while the on-demand course does a great job of explaining it, it doesn't give you the chance to ask those questions. So we want to make sure we offer it live. WPS does offer you a few different options. We do have a skilled nursing facility playlist, and the consolidated billing one and the skilled nursing facility one do go hand in hand, but they are going to focus on different things. If you're a skilled nursing facility and you want to learn about how to bill for your services, that's the second list. The other list is applicable to anyone, including the skilled nursing facility, but anyone that may have to bill them under consolidated billing. So we wanted to make sure you're aware of that. We do have some quick references and other things like that, but because there are so many, we put together a training page. And let me just show you that really quick because it might be helpful to people. So it's on the WPSGHA.com website. And if you go to the training center, you can scroll down. Well, I'm sorry, you'll have to pick your jurisdiction, set the license, and then you're going to scroll down and you're looking for the specialty area here. So for ambulance, you have your own training page. And then for skilled nursing facility consolidated billing, which is what we're focusing on today, there is a training page, and it will give you links to all the stuff we kind of talked about. And then also some other WPS resources that may be helpful as well. So if I were to select this playlist, it'll bring up the consolidated billing playlist, and you can see all of the different videos that we've done in the past. Also this one will be on there. So here's the old video that we did a year ago. We're redoing it now, so this one will come down and the new one will go up. All right. So I just thought I would show that to you in case you're interested. It is a really nice resource if you want to use it. All right, let's do one more check. Mary Sue, any questions?
I'm sorry, mute issues. No further questions have come in.
All right, so I'm going to go ahead and finish up then, y'all. So thanks for coming. Oh, you will be getting a certificate of achievement. This certificate of achievement is important that you look at it. And the reason that I'm sorry, you will be getting a follow-up email which contains your certificate of achievement. Follow-up email. The system automates this email. So if you called in, you won't be getting this. If you didn't sign in with an email and you signed in mobilely, sometimes the mobile doesn't do that. So be aware of that. We'll talk more about that in just a few moments. But if you do get this, go to the bottom, and that's where your certificate of achievement is. The contact hours is what the CEUs are based on. The reason that we say CEUs with a question mark is because it's up to the governing body whether they recognize our contact hours and how many that's good for. So please be aware of that. Here's your first opportunity where you'll see the survey provided. It's going to come out a lot more, so don't think this is the only chance you're going to get. Okay, but again, certificate of achievement. This email is sent through an automated email, and you have to have given us your email when you signed in. If you called in, you won't get this, but I'll explain how you get your certificate on a few more slides down. Follow-up questions, actually on the next slide. This is where you can send us follow-up questions. You do have 7 days to send in follow-up questions. Please put SNF CB SNF space CB space for ambulance, SNF CB for ambulance in the subject line. If you called in or you signed in with a mobile app but it didn't ask for your email or anything like that, you can email us here, again, using SNF CB for ambulance as your subject line, and simply add in, hey, I called in, here's my phone number, including area code that I called in from, can I get a certificate? Or I signed in via the mobile app, here's my name, I didn't get the follow-up email. All of those are perfectly valid options. Otherwise, if you come up with a question in the next 7 days, you can email that in to us as well. Survey. Take time to give us your feedback. And again, I want the good, the bad, the ugly in the survey. I'm going to have Mary Sue put a link in the chat. You'll be getting the follow-up email, which will have it. When we leave this, you're also going to get a pop-up box. It's going to give you to an external site and you can click continue. It's just, this is not spam. This is not malicious software. This is not anything like that. It's us asking you to take our survey. Also, if you happen to choose to listen to this as an encore, I'm going to give you another chance to take the survey by looking for this online survey picture. When this appears, you can select it and it will allow you to get to the link to take the survey. So lots of opportunities. Once again, the good, the bad, and the ugly. What did I do well? What does WPS do well? What could I improve on? What could WPS improve on? And did you like my presentation? Did you like the websites that I showed you? Please don't grade me on the CMS website. I have no control over that one, but you can still give me comments or things like that. We'll take all of those in. On this survey, please include any topics you would like to see in the future. If you just put ambulance education though, I don't really know what you want and I'm not sure where that goes. If on the other hand, you put ambulance medical necessity or ambulance assessment or physician certification statement for ambulance, all of those would be great topics and you can give me any suggestion like that you have. I do want to let you know that we do listen to people and we do definitely hear you when it comes to the surveys. We have implemented chapters in our YouTube, and these are little chunked out sections to help you locate the information. So if you go to watch this encore presentation on YouTube, I will have chapters that will help you locate what you need. Also, training indicators. If you watch our e-news or you look at our website, you will see that we have training indicators. And our goal with these indicators is to help you determine whether or not they belong to you. Keep in mind, we do listen. We are, looking at and beginning to work with how we can make some training center changes and a variety of other things. So that's all I have for you. I want to thank you guys for attending. Thanks for your time today. Wish you a great day. You may now disconnect.